Diabetes is the 7th leading cause of death in the U.S. and can cause serious health complications, including heart disease, blindness, kidney failure, and lower extremity amputations. In this video, we'll take a brief look at what diabetes is, explore the different types of diabetes, look at the signs and symptoms of diabetes, the effects diabetes has on the body, treatment options, and ways to manage diabetes. So what is diabetes? Diabetes is a disorder of the metabolism. The metabolism is the rate of how the body uses energy. The energy that our body uses is in the form of glucose. The carbohydrate sources that we eat are broken down into glucose. After carbohydrates are digested, glucose passes into the blood where it's used by the cells for growth and energy. For glucose to get into the cells, insulin must be present. Insulin is the key that unlocks the cells to allow glucose to enter. Insulin is a hormone produced by the pancreas, a large gland behind the stomach. When we eat, the pancreas makes the right amount of insulin to move glucose from the blood into our cells. In people with diabetes, however, the pancreas either produces little or no insulin, or the cells do not respond appropriately to the insulin that is produced. This is called insulin resistance. There are several different types of diabetes. The most common form of diabetes is type 2 diabetes and was formerly called adult onset diabetes or non-insulin dependent diabetes. Type 2 may account for 90 to 95% of all cases of diabetes. The onset of type 2 diabetes is usually gradual and associated with being overweight, increasing age, inactivity, family history, and certain ethnic groups. When type 2 diabetes is diagnosed, the pancreas is usually producing enough insulin, but for unknown reasons, the body cannot use the insulin effectively. This condition is called insulin resistance. Over time, insulin production can decrease. Type 1 diabetes, which was previously called insulin-dependent diabetes mellitus or juvenile onset diabetes, may account for 5 to 10% of all diagnosed cases of diabetes. Type 1 diabetes is an autoimmune disease which results when the body's system for fighting infection, the immune system, attacks and destroys the insulin-producing beta cells in the pancreas. Autoimmune, genetic, and environmental factors are involved in developing type 1 diabetes. Therefore, people with type 1 diabetes must take insulin because their body cannot produce insulin. Prediabetes is another possible disorder of the metabolism and is often incorrectly called borderline diabetes. Prediabetes is when insulin resistance starts, then progressively gets worse, which can develop into type 2 diabetes. Prediabetes is a condition in which the blood sugar is not high enough to be considered diabetes, but is above the normal limit. The final type of diabetes is called gestational diabetes and is a form of diabetes that only pregnant women get. It's caused by the increased hormones of pregnancy, which creates insulin resistance or a shortage of insulin. Gestational diabetes develops in 2 to 10% of all pregnancies, but will usually disappear after the birth of the baby. Women who've had gestational diabetes have a chance of developing type 2 diabetes. When glucose does not move into the cells to supply energy for the body due to diabetes, it can build up in the blood and cause many of the common signs and symptoms of diabetes. People who think they may have diabetes must visit a physician for diagnosis. These are some of the common signs and symptoms of diabetes: frequent urination, excessive thirst, extreme hunger, unexplained weight loss, extreme tiredness, irritability, blurred vision, and slow healing cuts and bruises. Remember, you may have several of the signs and symptoms mentioned or none at all. The only way to know for sure is to visit your doctor. There are 3 different tests your doctor may use to determine whether you have prediabetes or diabetes. Those tests include the A1C test, the fasting plasma glucose test, and the oral glucose tolerance test. The blood glucose levels measured tell if your metabolism is normal or if you have prediabetes or diabetes. Anyone aged 45 years or older should consider getting tested for diabetes, especially if you're overweight. You should also consider getting tested if you're younger than 45 but are overweight and have one or more additional risk factors, such as a family history of diabetes, are African American, American Indian, Asian American, Pacific Islander, or Hispanic, had prior history of gestational diabetes, had high blood pressure, have abnormal cholesterol levels, or are usually not physically active. When diabetes goes undiagnosed or diagnosed but not controlled, glucose begins to build up in the blood. The glucose then overflows from the blood and dumps into the urine and other parts of the body. Over time, this can lead to many of the serious health complications associated with diabetes. Cardiovascular disease is the leading cause of early death among people with diabetes. People with type 2 diabetes have higher rates of cholesterol and triglyceride abnormalities, obesity, and high blood pressure, all of which are major contributors to high rates of cardiovascular disease. Many people with diabetes have several of these conditions at the same time. This combination of problems is often called metabolic syndrome. Diabetes may affect eyes in many ways. It can cause blurred vision, double vision, cataracts, glaucoma, and retinopathy. This happens due to high blood glucose and high blood pressure causing small blood vessels to swell and leak liquid into the retina of the eye. Regular eye exams are important to detect problems early. You'll want to see a doctor if you have changes in your vision that last longer than a day, you have a sudden loss of vision in either eye, or you see black spots, lines, or flashing lights. People with diabetes can develop nerve damage called neuropathy. Having high blood glucose for many years can damage the blood vessels that bring oxygen to some nerves as well as the nerve coverings. Symptoms of nerve damage include numbness, pain, weakness in the hands, arms, feet, and legs, as well as tingling, burning, and loss of feeling. It's estimated that 50% of those with diabetes have some form of neuropathy, but not everyone has symptoms. People with diabetes can develop nerve damage at any time, but the longer a person has diabetes, the greater the risk. The best way to prevent neuropathy is to keep your blood glucose in control. Nerve damage, circulation problems, and infections can cause serious foot problems for people with diabetes. Nerve damage can sometimes deform and misshape feet, causing pressure points that can turn into blisters, sores, or ulcers. Poor circulation may make these areas slow to heal and can sometimes lead to amputation of the toe, foot, or leg. If you have diabetes, you'll want to get your feet examined 4 times a year and check for nerve damage at least once a year. Diabetes may cause damage to the kidneys known as diabetic nephropathy. Damaged kidneys lose their ability to filter out waste products from the blood. Waste begins to build up in the blood and may lead to kidney failure. Diabetic kidney disease happens slowly and silently, so you might not feel anything is wrong until severe problems have developed. It's important to get your blood and urine checked for kidney problems each year and see your doctor if you develop a bladder or kidney infection. People with diabetes may have more problems with their teeth and gums due to high blood glucose. High blood glucose helps bacteria grow and often makes tooth and gum problems worse. Gingivitis, periodontitis, gum disease, and fungal infections are more prone to happen with high blood glucose, especially those who do not practice proper oral hygiene, such as regularly brushing and flossing their teeth properly. Diabetes can affect any part of the body. The good news is that you can prevent most of these problems by keeping your blood glucose levels under control, eating healthy, regular exercise, and by controlling your blood pressure and cholesterol. Healthy eating and physical activity are key pieces for treating both type 1 and type 2 diabetes. With type 1 diabetes, insulin injections are necessary and must be balanced with food intake and daily activity while closely monitoring blood glucose levels. With type 2 diabetes, many people require oral medication, insulin, or both to control their blood glucose levels. People with any type of diabetes must take responsibility for their day-to-day care and keep blood glucose levels from going too low or too high. Research has found that moderate weight loss and exercise can prevent or delay type 2 diabetes. Eating right, staying active, and maintaining a healthy weight are practical things we can all do to reduce many of the risk factors associated with developing type 2 diabetes. If you have diabetes, the following daily habits are necessary for optimal health and are good tips for the health of anyone. Do not smoke, control your blood pressure, control your cholesterol, take your medications as directed, brush and floss your teeth daily, follow a healthy eating plan, be active for a total of 30 minutes most days, check your feet daily, check your blood glucose levels every day and log it. Diabetes care and prevention can largely be done through health behaviors you're hopefully already doing. General health practice such as oral hygiene, a proper diet, not smoking, managing blood pressure, and daily exercise will not only help you avoid a broad range of preventable health problems, it will also keep you on track to preventing or managing many of the risk factors associated with diabetes. This video was made possible with funding from the Centers for Disease Control and Prevention.